Mountain Time. We're doing these live sessions 30 days in a row, except for the fact that I missed it for the last 2 days. So today we're going to talk about changing something, trying to be more perfect. We're going to talk about what you do when you try to change a lifelong pattern that you've done forever, and suddenly you realize that that might not be the healthiest thing to be doing. So I'm Dr. Natalie Gonzalez. I'm a retired surgeon. I went back to train for integrative and functional medicine. Integrative means that I use the best of both complementary and conventional medical treatments to optimize my patient's health. And functional means that I look for the root cause. I look for the underlying reason that they have a health condition, and that's where we deal with it, not just put a Band-Aid over the symptoms. So this morning, yes, I got off for the weekend. I was dealing with some family crises, health crises. Anyway, plural. I was dealing with a lot of problems through the weekend with my family. And so I really had to give myself a little bit of room here to not have to get back on, since we're right in the beginning stages of our live sessions and I'm trying to get used to doing this. I probably won't be doing it every day. So we will be eventually transitioning to certain days of the week for this. And occasionally I might have a recorded session for it to fill in for those times when life gets in the way. So, and that's what we're going to talk about this morning, when life gets in the way. So I think, one of the things that comes to mind when we're trying to make some major changes in the way we eat or how we live is how difficult that is to do it all at once. And the first thing I want you to be thinking about is not doing it all at once, taking one thing at a time and really focusing on that one thing, and then actually celebrate when you are able to do it consistently, because changing everything all at once will not work. And to take one habit and really do it well will affect all the other areas of your life anyway. And you should be able to celebrate that. So I think for me, in my early years, I know that I used exercise. Exercise was my first thing that I really started to do well in my 20s that I never did well as a child or in my teens. And it wasn't actually till late teens that I actually started to focus a little on that area, realizing that I didn't always have to be the least athletic person or the most sedentary person. And that was a big mind shift for me, because I always thought, and I always knew that I was the last to be picked for the teams on sports. I was the one who was always the last in whatever we did. I was very slow, and, dealing with exercise induced asthma because I just didn't work out at all. And so, your lungs aren't used to doing anything. So, exercise was one of the first ones that I did. And I just started to keep track on a calendar of the days that I did anything, any kind of physical activity. I kept track of it on a calendar until that became routine. And then the next thing I probably chose was trying to get some calcium in my body on a regular basis, because I was not focusing on that. And then I think I went to, just focusing on not having so much fat in my diet, which got to be a problem. I mean, in medicine, we talked about no fat for a long, long time, and we developed a lot of people that became very sugar dependent. And we developed a lot of diabetic and pre-diabetic people during that time period when we were really stressing not taking in fats. And I think you know, to actually get better at that in my later life, I had to realize that there are some healthy fats that you find in nuts and seeds and avocados and food like that. And then there are some very unhealthy fats that really cause a lot of inflammation in our body. And those are going to be your saturated fats that you get from animals. And those are the same kind of fats that tend to increase our rate of both heart disease and cancers. So that was another shift. Another shift has been a shift from realizing that there's a difference between processed sugars and glucose and unprocessed. So that the unprocessed uh, sugars and sweeteners in our diet, as long as they're contained within the cell wall of a plant, within the fiber, you are not going to have the same bad effect of it as you would if you were taking in processed sugar or something that's just absorbed so quickly into your system. So that's another mind shift that I've had to deal with and had to do some changes in my diet. And as often as I know that the research is shifting and I'm having to shift my own mindset as a physician, I know how hard that must be for somebody who doesn't have my science background or ability to look at the research evidence behind these things and try to make a decision for themselves. And helping my family do it has been really an eye opener for me to recognize how hard it is for everybody out there. And so I want to just encourage you to be thinking about making one shift at a time. And when you feel like you've accomplished that a little bit, maybe you stop eating the bread. It took me 2 years to stop eating breads that had flour and sugar and all kinds of other additives to them that were raising my blood sugar, to stop doing that, to stop eating tortillas and the flatbreads and all of those things we just get so used to. um, I think has been a really difficult thing for me. It took me 2 years to do that. So for me to expect that I'm going to just tell somebody, okay, this is the optimal diet, go ahead and do all these things, that's not easy. I'm working with my father right now who's dealing with a cancer, and to change the mindset of eating the things that are feeding that cancer to eating the things that are not feeding into the cancer. That's a very, very difficult mindset and shift for him to make. And it's a critical thing right now. So he doesn't have a lot of time to adjust to it or think about it for a while. And so, we're just trying to cut off the supply lines to his cancer and stopping the food that's feeding that is a very big mind shift. And it's much easier if you're not in that critical stage where you actually have a cancer that you know about. We know we all have cancer cells that circulate throughout our body all the time. And if our immune system is really working well, then we're keeping those cancers depressed or suppressed. We're keeping them from actually developing a visible tumor. And so, most of us have a little bit of time with this, but my father doesn't have a lot of time to absorb this new information and then say, okay, I'm going to change my diet now. So a little bit more tricky. So this morning, I just want you to be thinking about doing these changes one at a time. Choose that change, shift that mindset, shift that change a little bit at a time on a day-to-day basis. And once you feel like you've been able to do that, then I want you to choose another one. And so we will be continuing to encourage you with these things throughout the week this week. I will be more consistent than I was over the weekend with the family crisis going on. And I will celebrate every time I get this right, just like I want you to celebrate every time you get something right. And thank you for being here. Send me your questions. If you think this information has been helpful for you, share it with somebody you know that it would be helpful for. And if you don't know somebody, then like it so that you too will know to share it with somebody else like you. And if you haven't subscribed, go ahead and do that. And we will see you back here in the next live session or with the next video. So take care. Have a great day.